Menopause myths are everywhere, and today I want to set the record straight. Let's talk about the top 5 menopause myths that need to be busted by an OB/GYN. I'm Dr. Jen, hormone and metabolic health expert, double boarded in OB/GYN and integrative medicine. So menopause myths, they're everywhere. And online, I'm so excited that there's more education and that women are getting access to information, but we need to make sure we're getting correct information. So the first menopause myth I want to talk about is that hormone replacement therapy is dangerous. To be honest, most women are candidates for hormone replacement therapy. Very few people can't even use it. In fact, there's even vaginal estrogen for those women who have breast cancer or a history of blood clots. And there's even options for women who've had blood clots that are non-hormonal that are available. So we need to destigmatize hormone replacement therapy because most women are actually candidates, and there are a lot of options specifically to meet your needs, depending on things that you want to use and also what's the safety profile for you. If you have more questions specifically about hormone replacement therapy, I made a video called Doctor's Guide to Hormone Replacement Therapy, and you'll be able to see the link and be able to check out the different options. Number 2, weight gain is inevitable. This is probably the one that drives me most bonkers because a lot of women come to me and say, my doctor told me weight gain is normal. I'm getting older and I should just accept it. I could choose to eat less and exercise more. It's my option. And I just think that that's completely terrible information. First of all, your metabolism changes because of menopause, not only from estrogen and progesterone going down and testosterone, but also insulin gets affected. You become insulin resistant. Your thyroid may be affected by menopause. Your absorption of certain nutrients can be affected. So it's not just about eat less, exercise more. It's really about understanding how the body changes and how it affects all the different hormones. And honestly, when you focus on what's going to happen to you in your 40s and 50s and start in your 30s, the health of your perimenopause and the journey of your perimenopause will change depending on how healthy you are in your 30s. So I strongly encourage women who are younger to start looking at how they have to incorporate things that they're going to need to change in your 40s to change your metabolism. So it is not inevitable. There are ways to reverse that weight gain, and there's certainly ways to prevent it if you start early. Number 3, menopause means your life is over. I think there's a lot of great things. I know I talk a lot on my videos about kind of symptoms and signs and things that are going to happen to you, but there's a lot of great things that do happen in perimenopause. First of all, you learn a lot about yourself. You kind of have to do some self-reflection, and you have to prioritize self-care. In your 20s and 30s, when you're running around, or even when you start having children, you often don't prioritize yourself, you prioritize your kids. And now in perimenopause, you have to focus on you and the important things in life, the connections, the relationships, the learning about yourself. And sometimes I call it developing the BS meter and letting go of things that don't serve you and maybe not saying yes to things that are not going to help you. So there's a lot of really great things that actually do happen. Your children get older, and I find right now as my kids are teenagers, it's fun. It's like having little friends to hang out with all the time. So it's a very different relationship, and there are a lot of great things that can develop as you go through this journey. Look at the positives, and I think overall we should focus more on those things. Number 4, hot flashes are the worst part. Hot flashes are just one symptom. There are over 80 different symptoms associated with menopause. In fact, mental health challenges 4 times more anxiety, 3 times more depression. A lot of women really suffer from anxiety, depression, apathy, just not feeling like themselves anymore, feeling alone, maybe not having the support from their partners. So those are things that we need to focus more on and teach women about the changes that happen to your mental health. And I'm glad that these conversations are more open on platforms like Instagram and YouTube, and to help reach out to those women who are really struggling, because you don't have to suffer. There are options for treatment, and I think it's important that we look at those options and try to teach other people about what is available. And along with, like I said, hot flashes aren't the worst part. There are women who also have vaginal dryness, more UTIs. They may have hair loss. They may have brain fog. So there are a lot of different symptoms, and we need to focus on not just hot flashes, but the other symptoms. In fact, I would love that the FDA changed indication for hormone replacement therapy to not just be about hot flashes and vaginal dryness or hypoactive sexual desire disorder, but to encompass more symptoms that can actually help help with, your brain, your bone, your muscles, and those things are really important too to advocate for hormone replacement therapy. Lastly, menopause myth number 5 is you can't enjoy intimacy anymore, which is completely not true. There are women who have very vibrant, healthy sex lives in perimenopause and menopause. In fact, I have a patient who's in her 80s who's having sex and she's doing great and life is awesome. So it does not have to change. What we need to do is understand how libido is affected by not only hormones but other factors, and we need to have more options available for women to use to improve their libido. There are like 15 Viagras and all their generics, not necessarily Viagra, but all the different products that are the same category, and yet we have only 2 FDA-approved drugs for hypoactive sexual desire disorder in perimenopausal women. We don't have an FDA-approved testosterone. We just don't have the same resources that men do, and it's about time we start advocating for this. We talk to our congressmen and congresswomen about getting more money for research for women's health and more medications that are helpful, and we open up the conversations about sexual health, because sexual health is part of medicine. It's part of your overall health. So we need to open these conversations up and be able to talk to not only our healthcare provider, but our friends and our family members about how this affects us. So I hope that you got something from this video. Please like and subscribe to this channel. If you have questions specifically about a menopause myth, I'm happy to do a separate video about that. Just leave it in the comments.